Well, it is great to be back here in the Keystone State. It's even better to be out of Washington, D.C. First of all, the people of D.C. are wonderful. They're nice people. They're good people. Love the city, the monuments, everything. But when you're in Washington, folks respond to every issue, every decision, every debate, no matter how important it is, with the same question. Well, what does this mean for the next election? What does it mean for your poll numbers? Is this good for the Democrats or good for the Republicans? Who won the news cycle? That's just how Washington is. They can't help it. They're obsessed with the sport of politics. And so that's the environment in which elected officials are operating. And you've seen all the pundits pontificating and talking over each other on the cable shows, and they're yelling and shouting, and they can't help themselves. That's what they do. But out here, and all across America, folks are worried about bigger things. They're worried about how to make payroll. They're worried about how to make ends meet. They're worried about what the future will hold for their families and for our country. They're not worrying about the next election. We just had an election. They're worried about the next paycheck or the next tuition payment that's due. They're thinking about retirement. You want people in Washington to spend a little less time worrying about our jobs, a little more time worrying about your jobs. Despite all the challenges we face, 2 wars, the aftermath of a terrible recession, I want to tell everybody here today, I am absolutely confident that America will prevail, that we will shape our destiny as past generations have done. That's who we are. We don't give up. We don't quit. Sometimes we take our lumps, but we just keep on going. That's who we are. But that only happens when we're meeting our challenges squarely and honestly. And I have to tell you, that's why we are fighting so hard to deal with the health care crisis in this country. Health care costs that are growing every single day. I want to spend some time talking about this. The price of health care is one of the most punishing costs for families and for businesses and for our government. It's forcing people to cut back or go without health insurance. It forces small businesses to choose between hiring or health care. It's plunging the federal government deeper and deeper and deeper into debt. The young people who are here, you've heard stories, some of you guys still have health care while you're in school. Some of you may still be on your parents' plans, but some of the highest uninsurance rates are among young people, and it's getting harder and harder to find a job that's going to provide you with health care. And a lot of you right now feel like you're invincible, so you don't worry about it. But let me tell you, when you hit 48, you start realizing things start breaking down a little bit. And the insurance companies continue to ration health care based on who's sick and who's healthy, on who can pay and who can't pay. That's the status quo in America, and it is a status quo that is unsustainable for this country. We can't have a system that works better for the insurance companies than it does for the American people. give families and businesses more control over their own health insurance, and that's why we need to pass health care reform. Not next year, not 5 years from now, not 10 years from now, but now. Now, since we took this issue on a year ago, there have been plenty of folks in Washington who've said that the politics is just too hard. They've warned us we may not win. They've argued now is not the time for reform. It's going to hurt your poll numbers. How's it going to affect Democrats in November? Don't do it now. My question to them is, when's the right time? If not now, when? If not us, who? Think about it. We've been talking about health care for nearly a century. I'm reading a biography of Teddy Roosevelt right now. He was talking about it. Teddy Roosevelt. We have failed to meet this challenge during periods of prosperity and also during periods of decline. Some people say, well, don't do it right now because the economy's weak. When the economy was strong, we didn't do it. We've talked about it during Democratic administrations and Republican administrations. I got all my Republican colleagues out there saying, well, no, we want to focus on things like cost. You had 10 years. What happened? What were you doing? Every year, the problem gets worse. Every year, insurance companies deny more people coverage because they've got pre-existing conditions. Every year, they drop more people's coverage when they get sick, right when they need it most. Every year, they raise premiums higher and higher and higher. Just last month, Anthem Blue Cross in California tried to jack up rates by nearly 40%. 40%. Anybody's paycheck gone up 40%? I mean, why is it that we think this is normal? In my home state of Illinois, rates are going up by as much as 60%. You just heard Leslie, who was hit with more than 100% increase. 100%. One letter from her insurance company, and her premiums double. Just like that. And because so many of these markets are so concentrated, it's not like you can go shopping. You're stuck. So you've got a choice, either no health insurance, in which case you're taking a chance if somebody in your family gets sick, that you will go bankrupt and lose your home and lose everything you've had, or you keep on ponying up money that you can't afford. See, these insurance companies have made a calculation. Listen to this. The other day, there was a conference call that was organized by Goldman Sachs. You know Goldman Sachs. You've been hearing about that. All right. So they organized a conference call in which an insurance broker was telling Wall Street investors how he expected things to be playing out over the next several years. And this broker said that insurance companies know they will lose customers if they keep on raising premiums. But because there's so little competition in the insurance industry, they're okay with people being priced out of the insurance market because, first of all, a lot of folks are going to be stuck. And even if some people drop out, they'll still make more money by raising premiums on customers that they keep.